When we consider the foot has 4 layers. Layer 1 is abductor minimi, abductor hallucis, and flexor digitorum brevis. Layer 2 is lumbricals, flexor digitorum longus, flexor hallucis longus, quadratus plantae. Layer 3 is adductor hallucis, flexor hallucis brevis, flexor digitorum FDM. Layer 4 is interossei, which is plantaris and tibialis posterior. Neurovascular bundle is between the second and the third layer. Regarding the foot compartments, there are 9 compartments. So we remember as medial compartment, lateral compartment, interossei, which are 4 separate compartments, and a central compartment. The medial compartment contains abductor hallucis and flexor hallucis brevis. The lateral compartment consists of abductor digiti minimi and flexor digiti minimi brevis. The central compartment consists of superficial, which is flexor digitorum brevis, middle compartment, which has quadratus plantae, and the deep compartment, which is adductor hallucis. Regarding foot compartment syndrome, acute decompression is controversial because the long-term morbidity of multiple fasciotomy is almost equal to the ischemia created by the leg. Most guidelines states there is no consensus of foot compartment syndrome. The most common cause of foot compartment syndrome by itself is a calcaneal fracture. When I'm going to give incisions, I prefer to do 2 dorsal incisions and 1 medial separate incision. So 3 incisions. The first incision is between the second metatarsal space. I decompress the first and second interossei, medial, and the deep calcaneal compartment. The dorsal, I give fourth metatarsal space incision, which leaves the third, fourth interosseous, lateral and superficial and middle central compartment. I will open the fascia longitudinally. The medial incision will be beneath and parallel to the first metatarsal. The problems which can happen with the foot compartment decompression is pain, hypersensitivity, nerve injury, clawing of the toes, and stiffness.